Ladies and gentlemen, thank you very much for the opportunity to make some remarks at the Convention on Health Analysis and Management 2020. Germany is often referred to as a positive example of how to manage the COVID-19 pandemic. Indeed, we were successful in preventing to overburden our health system. We were able to flatten the curve of infections in spring, and the proportion of severe cases and fatal causes is lower in Germany than in many other countries so far. But this makes us humble rather than overconfident. There are many reasons for this development, but let me highlight the most important ones. First, our healthcare system is in a very good shape. Everyone has had full access to medical care. This is a merit not just of the current government, but of a system that was built over the course of many governments. With an excellent network of general practitioners available to deal with milder COVID-19 cases, hospitals have been able to focus on the more severely ill. Second, we had time to prepare. In Germany, we have been alerted and took the virus serious from the very beginning. And so indeed, we reacted quickly, very early on, and increased the capacity of ICU beds by 12,000 beds to 40,000 beds in total. We used the time we gained to prepare our people and the system. Third, Germany is home to many laboratories that can test for the virus and to many distinguished researchers in the field, which helps to explain why the first rapid COVID-19 test was developed here in Germany, in Berlin. Overall testing is crucial. Without it, you can't have the right picture of this corona epidemic. We have increased testing capacities steadily and have tested already more than 14 million people. We have to know exactly how many people really are infected, how many are asymptomatic or very mild, etc. These numbers help us forecast the pressure on our healthcare system now that we have reopened the economy and social life. So far, Germany has been lucky with the proportion of deaths from reported COVID-19 cases compared to other countries. Why this is the case has not yet been answered conclusively. At present, one can only make assumptions. One most probable factor was that patients in France, on average, were older and therefore more at risk of severe illness than in Germany. Initially, in Germany, many younger people were affected. So it was mainly people who did not belong to the risk groups who were affected in Germany, since many transmission chains were connected with skiing holidays, international travel, carnival, and other festivities. In addition, what may also have played a role was that in Germany comparatively more people were tested. This means that the infection was detected among more people with milder symptoms. In other countries, where in some cases only severely ill people in hospitals were tested for SARS-CoV-2, milder courses may have remained undetected. Those mild cases were then not included in the total number of cases, which makes the proportion of deaths seem comparatively high. Research will only reach a definitive answer in hindsight. So in summary, yes, Germany has been able to react well in the first months of this pandemic. But let me also say this: nobody has predicted this crisis. And as far as I know, there is no country that has really and fully been prepared for a crisis like this. In practice, we see that all countries have had problems meeting the enormous demand for protective clothing. This is definitely a lesson for Germany and Europe, not to be too dependent on one country or region for things like protective clothing and medication. This is why we Europeans must reconsider how we approach globalization. We will need to diversify our supply chains to avoid being wholly dependent on any one country or region. But rethinking globalization does not mean reducing international cooperation. On the contrary, joint efforts among European Union member states are already driving progress toward a vaccine. Once discovered, it is only prudent to ensure that the vaccine is produced in Europe, even as it is made available worldwide. Like most crises, this one offers opportunities too. In many areas, it has brought out the best in us. A new sense of community, a greater willingness to help others, renewed flexibility and creativity. There can be no doubt that the medium-term consequences of the pandemic will be tough. But despite all the difficulties and uncertainties that lie ahead, I remain optimistic. In Germany and elsewhere, we are witnessing what our liberal democracies and our citizens are capable of.